Hello everyone, my name is Jiao Fen. I'm the nurse practitioner student here. Today we are going to do a physical exam for a newborn baby. So this is a baby Andy. He was born from 3 days ago, and he got discharged yesterday. Today he's here for hospital follow-up visit, 3 days visit. Upon the visitation, we asked the mommy about the baby's history of prenatal care. The mom was in regular prenatal care in her OBGYN physician's office, and then this baby was from a normal spontaneous vaginal delivery. This baby, when he was born, his weight was 7 pounds and 8 ounces. The mom said there was no complication from the prenatal care and the labor and delivery, and she does not recall this baby was put on the breathing machine or oxygen or NICU. So it's a normal spontaneous delivery baby. And then after they went home, the mommy has been feeding the baby every 3 hours, exclusively breastfeeding, and she also changed the diaper every 3 hours, and she noted every time when she changed the diaper was wet, and there was also a yellow stool every single time when she changed it. So baby pooping about 8 times per day and urinating at least 8 times per day. The examination of the baby. So first we are going to check the weight of the baby. We put baby on the scale, make sure we take off all the clothes and change diaper to a new dry diaper before we check the weight. So today the weight is 7 pounds and 2 ounces. There's a little bit weight loss, which is normal for the first 10 days after the delivery. Then we also check the baby's height, which is length. So we put the baby on the measuring board, and we put the head against the board, and then we stretch so the baby's position is like this. We stretch the leg, and we measure the end of the leg. So from the head to the end of the leg, measure the length, and this baby is about 19.6 inches. Now the next we are going to check the baby's head circumferences. We use the measuring tape, and then from the bottom of the head, from the pointing right above the eyebrow area, and the measurement comes out 11.8 inches for this baby. We also can check the oxygen level, check the oxygen level on the finger, and come out oxygen is 98%, which is good. Alright, so now we come to the general physical exam. In general, this patient is a very well nourished and very well developed child, active, cooperative, and he is very interactive with his parents and also with the examiner. And then the baby's skin is pink in color. There is no jaundice. There is no cyanosis noted. There is no erythema, no bleeding, and no bruises noted. And there's no rash, and the skin turgor is normal. There's no edema noted. So the skin is good. The lymph node we check from the occipital area, posterior auricle, anterior auricle, cervical area, supraclavicle, and we check also the inguinal area. I do not feel any enlarged lymph node, which is normal, which is a good sign. Now we are going to do a head-to-toe assessment. From the head, we want to inspect if there's any swelling on the scalp, which in this baby there's no, and the hair is normally distributed. And then we palpate. We also see the the sutures on the scalp, and we can see and we can feel the anterior frontalis and posterior frontalis, which is, it's still open, it's soft, and you tell the patient, tell the mom, do not press it too hard. And then for the inspection of the head, it's a normal size, and then it's normal size, and it's round. So again, I see the sutures, and then the head circumferences we measured earlier is 11.8 inches. So there's no facial paralysis, there's no facial twitching, which is a good sign. And then now we're going to check the eyes. So for the eyes, in the clinic, I'm supposed to bring in a ophthalmoscope and look into the eyes, and then I do see the red reflex here in the right eye and the red reflex in the left eye, so that means it's normal finding. If there's no red reflex, that's indication of cataract or retinal problem, blastoma. So in that case, we need to send a referral to ophthalmology. So the eyes, we also use the flashlight to check the accommodation and also check the light reflex. This patient it's PEERLA, so there's no abnormalities in eyes. Now we move on to the ear. Since this baby is a newborn baby, the ear canal is so small, so we are not able to look into the ear canal. We pay attention to the external area. The external ear looks normal shape, and then there is no redness, no ear discharge noted from the ear. And then upon palpation, there's no tenderness and no redness upon inspection either. So the ear is normal. Now we're gonna move on to the nose. We noticed the nose is normal shape, and then there's no flaring of the nostrils, and inside the mucosa is pink. There's no active bleeding, and there is no septal deviation, which is good. There is no airway blockage. There's no polyps or tumors inside of the nostril. Now we move on to the mouth. So for the mouth, the baby is completely breastfeeding, so we can smell the milky smell from the mouth, and then he has no teeth yet. His gum seems to be normal and pink, and there is no cyst on the gum, no discoloration, no bleeding. The buccal mucosa, I use the tongue depressor to go inside, take a look at the buccal mucosa. It is also normal. There is no white patches, there is no bleeding or bruises, no bleeding inside. So there's no lesion. I'm going to use my clean gloved finger, go inside of this baby's mouth, and what I'm trying to feel is to see if the soft palate is intact, the hard palate is intact, and also in the meantime the baby is going to suck my finger, so which is a sucking reflex, which is normal in a newborn baby. And outside of the mouth, we take a look at the lip to see if there's any cleft exist. If we have soft palate cleft or hard palate cleft or the lip cleft, we need to send a referral to a specialist for correction. Now let's move on to the neck. The baby's neck is a normal size, and then there's no abnormalities, no webbing of the neck. There's no edema noted. Again, the lymph node is non-palpable, which is normal finding. There's no masses, and the trachea is in the midline. There's no deviation of the trachea. The thyroid seems to be normal. There is no jugular vein distension. There's no jugular vein distension. The motion of the head. So we put the baby up, try to put the baby up, and his head is wiggling around, but the head is not dropping, and he's positive for nodding, and his head has normal range of motion, which is expected for neck. Now let's move on to the chest. So the chest, it looks symmetrical. There is no abnormal shape, no concave shape of the chest, and no protrusion of the chest. And it's symmetrical from inspection. Now we're going to check the lungs. So we see the respiration, the baby's chest is moving up, up and down, and it's moving fast. For this baby, the respiration rate is about 40 times per minute, which in the newborn baby, the normal range is between 30 to 6 times per minute. And then we also check to see if this patient has any dyspnea, and then upon palpation, we check if the patient has any masses, any fremitus, which is none in this baby. And we do the percussion. We do not feel any dullness and no hyperresonance of the chest, of the lungs area. Then we do the oscillation. So for the oscillation, we check both lungs. The breathing sound is normal, and we turn the baby around. The breathing sound is normal. There's no crackers, no rhonchi, and no wheezes. All right, next we are going to check the cardiovascular system, and then for this baby, we check the heart rate, and we do the inspection first. And for the inspection, it's normal vascularity. There is no bulging, no impulses, and then no distress of the patient. There's no cyanosis. There is no edema noted. Then the point of maximal impulses are located at the 5th intercostal space and the left mid-clavicular line. There is no thrill upon palpation. Then we're going to osculate this baby. So we osculate, use the diaphragm area, use the bell area, the aortic area, pulmonary area, Erb's point, and the bicuspid area. There are no heart murmurs noted. The heart rate is regular, and the heartbeat is about 120 beats per minute, which is normal in newborn baby. Newborn baby can be anywhere between 120 to 160 beats per minute. All right. Now, upon osculation, there's also no third heart sounds, no gallop, no friction rubs, which is good. All right, we're going to move on to the abdomen area. Abdomen, we are going to do the inspection first, and then it's the abdomen is normal shape. There is no distension. Then I'm going to listen to the bowel sound. 4 quadrants: right upper quadrant, right lower quadrant, left upper quadrant, and the left lower quadrant. And each quadrant, listen for 1 minute for the bowel sound. This baby has normal bowel sound, his bowel sound is about 5 times per minute, which is normal. We can also do the percussion to see if there's any excessive dullness to show any mass or fluids inside. In this case, this baby is negative upon percussion. And we also can check the liver megaly and the spleen megaly. It is negative for this patient. Now we're going to move on to the genitalia area. So while we are here, we're going to take off the diaper and take a look. This is a baby boy. So we take a look at the testicle area. We can use a flashlight to do the transillumination test. If it's positive, that indicates hydrocele. If it's negative, that's normal. And also we palpate to see how many testicles inside. In this case, this baby has 2 testicles, which is normal. If we only find 1 testicle, that means one of the testicles is not descended. We need to send a referral to urology specialist. Now, since we are here, we are going to check the baby's anus area. For the anus area, we see the stool, a little bit of stool here, but overall the skin is nice and clean, healthy. There is no rash. There's no diaper rash here. There's no fistula. There's no fissures, rectal fissures noted here. Also, there's no Mongolia mark, and there's no spina bifida noted. So rectal exam is normal. External exam is normal. Now let's move on to the muscular area. So the normal position of the baby, usually the both upper extremities and the lower extremities are flexed. That's their normal. And then the examiner, I can pull over one of the extremity and release it. Once I release, this extremity is supposed to go back to the flexed position. This means the baby has normal muscle tone. If I stretch and relax and the baby does not return to the flexed position, that means it's a weak muscle tone that needs to be further investigated. And now we move on to the nervous system. This is a very important system for newborn baby because they have a lot of reflexes that needs to be pay attention to. Earlier, number 1, we mentioned about the sucking reflex. We put the finger inside, then baby will suck the finger. That's normal. And there is also a rooting reflex, which we can use the finger to stroke the side of the mouth, and the baby is going to turn the head towards your finger and also try to open mouth to suck. So that's rooting reflex. And there is also something we call the stepping reflex, which we try to have the baby stand up, and the baby will stand, and the foot is going to pretend to walk to step. So that is a stepping reflex. And we can also check the baby's grasp reflex. We put our finger on the hand. Naturally, the baby is going to grab the examiner's finger. That is grasp reflex. And also we have a moral reflex, which is we try to hold the baby, and we try to put the baby on the bed, and the baby will have a startle reflex. That's the moral reflex, usually disappear in 2 months of age. And in newborn baby, they also can have Babinski sign, which means when we stroke the bottom of the feet, and the toes will spread around like a fan. So that is a normal sign in a newborn baby, but it's abnormal sign in adult. We can also use a hammer to check the deep knee jerk. So I do not have a hammer with me. I use the stethoscope to press, to percuss the knee, and the knee will go up. So that is a knee jerk, deep tendon reflex. And this baby also has negative Chauvet-Stokes sign, which we tap in the face and there's no facial spasm. That means Chauvet-Stokes sign is negative. That means he does not have a hypocalcemia situation. For the cranial nerve, the most important thing is about hearing and vision. So for the vision, when examiner or the parent move around him, he turned his head to his parents and to me. So that means his vision is good. And the same thing to the voice. When we talk to him on the side to the other side, he turns his head towards the voices. That means his hearing is also good. So this is the physical examination of the child. Now we are going to talk about the plan of care and the anticipatory guidance for the parents. And then since this is a newborn baby, the baby is going to have subsequent follow-up visit with us. So we're going to tell the mommy, baby will come back in 1 month and 2 months age, 4 months age, 6 months age, and 12 months. And after that, 18 months. Then after that, once a year. After the baby turned 2 years, it's once a year. So kind of give the parents about what to expect for the newborn baby, and then the anticipatory guidance for this newborn, especially important, is about to reduce the risk of chemicals exposure and toxins exposure. Tell the parents if they live in the old house, or if the parents, one of them, work in some area in contact with chemicals, they need to pay attention to clean the clothes before they enter the house, because the lead and other chemicals can be pretty toxic to newborn baby. And we encourage the parents to ask for help from other family members and friends for the child care. So we also ensure that the family can gradually establish daily routine, what time to go nap, what time go feeding, what time is the playing time, set up the routine. And we encourage the family to establish healthy communication between parents and child. And then we also want to, if there's any siblings inside of the family, we want to encourage the parents to please also make time to spend some time with other siblings, other family members, and significant others. Some other anticipatory guidance for the baby is we want to ensure the nutrition. For this baby, the mom decided to have exclusive breastfeeding, which for now she seems to have enough milk for the baby. So we encourage mommy to continue breastfeeding at least for 6 months. And during these 6 months, it's recommended for baby to start the iron and vitamin D supplement, because those nutrients are not available in the breast milk. And then if the parents decided to switch to formula, then formula feeding do not need any vitamin supplement. If the mom have excessive supplies of breast milk, we need to tell the parent of appropriate breast milk storage, which is in the freezer. Okay, and we talk about the sleeping safety. The baby should sleep on the back, and the baby should not sleep in crib with any blankets or any loose object inside of the crib. That's for the safety issue. And then another safety issue is if the baby goes out, the baby should have a car seat, and the car seat should face rear for the safety. And then when take bath for the baby, the temperature of the water should be less than 120 Fahrenheit. When warm up the milk for the baby, same thing, the temperature should be less than 120 Fahrenheit to avoid burns to baby's skin. In the meantime, for the mom, since this is a newborn baby, there's a lot of things happening at the same time. It's very stressful. We want to remind mom to recognize the signs and symptoms of postpartum depression and offer the mom the help, the hotlines, in case if anything needed, any help needed, the mom can reach out at a timely manner. This conclude. And then immunization. So for immunization, this baby, upon the newborn in the hospital, he already got the first dose of hepatitis B, and then anticipate second dose of hepatitis B in 1 or 2 months. 1 or 2 months. And then we'll tell the mom at 1 month visit we can give hepatitis B. Then at 2 months old we will give 5 vaccines to kindly prepare the mom. So it will be the D-type vaccine, polio vaccine, rotavirus, and Prevnar 13. Prevnar 13. Total of 5 vaccines will prepare the mom. This includes today's newborn visit. I hope you enjoy this video. Please give any feedback you may have. Thank you so much for watching.